And now to our big story at 5. Johnson & Johnson one-shot vaccine is being benched for now in the fight against COVID-19.
Federal regulators announcing a pause on the using of Johnson & Johnson after 6 women developed blood clots within 2 weeks of getting the shot. At least one of those cases proved to be fatal, while another left a patient in critical condition. Now, health officials say the risk is extremely low for those who got the shot a month ago or longer, and there is no indication of similar problems in either the Pfizer or the Moderna vaccines.
Wisconsin is following the federal government's recommendation and also pausing the use of the vaccine in our state.
Team coverage for you tonight. Christina Van Zels has reaction from city and county health officials.
Let's kick things off with Madeline Anderson, who joins us live to break down the potential impact on the state's vaccination efforts. Madeline?
Well, this announcement likely will not impact the state's vaccination pace. Officials say only about 2% of the doses coming into the state next week were of the Johnson & Johnson vaccine. Meanwhile, though, health officials are urging people who have received their shot at vaccination clinics like the one here at Nicolay High School last month, or those who have yet to get their shot, not to panic.
The Wisconsin Department of Health Services is instructing vaccine providers to hold off on administering the 10,000 doses of the Johnson & Johnson COVID-19 vaccine arriving in the state this week.
Label it at this point in time, do not use.
This in the wake of the FDA and CDC urging states to pause use after reports of a rare type of blood clotting following vaccination.
We're very hopeful that this will be a fairly short pause.
DHS Deputy Secretary Julie Willems Van Dyke says 159,000 people across the state have already received the single-shot vaccine, or about 4% of the total doses administered. She says while extremely unlikely, patients should seek medical attention if they experience severe headache, abdominal pain, leg pain, new vision problems, or shortness of breath within 3 weeks of their vaccination. Brown Deer resident Ryan Spielman says he'll be monitoring his health after rolling up his sleeve for the J&J shot at a recent clinic held at Nicolay High School.
If that number starts jumping up and I don't feel good in the next few days, yeah, then I'm freaking out. But right now, I'm feeling good.
Federal distribution of the vaccine will also pause. On a call with the White House Tuesday morning, Governor Tony Evers says this break will allow health practitioners time to identify any other instances of an adverse reaction and learn about the proper treatment.
The treatment for it is significantly different than normal blood clotting.
Tomorrow, the CDC's Advisory Committee on Immunization Practices will be calling an emergency session to discuss the data.
Our best and brightest are looking as closely as possible at this to tell us what are the safest next steps for the public health.
In the meantime, officials are urging Wisconsin residents who have yet to get vaccinated not to let this update discourage them.
This rare event is about 1 in a million for this vaccine. The risk of getting COVID in the United States is 1 in 10. The risk of dying from COVID is 1 in 600.
Now, those symptoms to watch out for should not be confused with the normal flu-like side effects you may experience 1 to 2 days after getting the shot. Reporting live in Glendale, Madeline Anderson, FOX 6 News.
All right, Madeline, thank you.